Have you ever wondered why sexual dysfunction in women is a topic so widely unspoken, despite its prevalence? This question, though provocative, is crucial to understanding the world we live in, a world where the sexual health of women is often relegated to whispers and hushed conversations. It's a curious paradox, isn't it? In a world that's more open and accepting than ever before, sexual dysfunction in women remains a taboo. It's a conversation that's shrouded in silence, brushed under the carpet, and often ignored altogether. Yet it's an issue that affects countless women across the globe, impacting their quality of life, relationships, and overall well-being. We're here today to break this silence, to bring this hidden conversation to the forefront, and to explore the reasons why it's so important to do so. Because you see, the silence surrounding women's sexual dysfunction doesn't just stifle conversations, it stifles understanding, research, and progress. It keeps us from fully comprehending the scope of the issue, from finding better treatments, and ultimately, from improving the lives of those affected. The prevalence of sexual dysfunction in women is staggering. It's not a fringe issue, a rarity, or an anomaly. It's a global concern affecting women of all ages, all backgrounds, and all walks of life. It's a part of the human experience, a part of women's health, and it's high time we recognized it as such. This silence, this taboo, it's not just harmful, it's detrimental. It stands in the way of progress, of understanding, and of empathy. It keeps us from seeing the full picture, from understanding the complexities of women's sexual health, and from working towards better treatments and solutions. So let's talk about it. Let's bring this issue out of the shadows and into the light. Let's break the silence, shatter the taboos, and start a conversation that's long overdue. As we delve into this topic, we hope to shed light on this important issue and contribute to the conversation. To understand the gravity of the situation, let's turn to the facts and figures. Sexual dysfunction in women is a silent epidemic, largely due to societal norms and stigma. It's estimated that around 40% of women worldwide experience some form of sexual dysfunction, making it a widespread issue that requires urgent attention. The age group most affected by sexual dysfunction varies, but research indicates that it's often prevalent among women in their late 30s to early 50s. This time frame, often associated with significant hormonal changes, can drastically affect a woman's sexual health. Now let's delve a bit deeper into the types of sexual dysfunction most commonly reported. These include disorders related to sexual desire, arousal, orgasm, and sexual pain. Among these, disorders of desire, often termed hypoactive sexual desire disorder, emerge as the most reported issue, affecting nearly 1 in 10 women. Arousal disorders, while less prevalent, still affect a staggering number of women, with around 1 in 20 women experiencing difficulty with sexual arousal. Orgasmic disorders and sexual pain disorders, though less common, significantly impact the quality of life for those affected. However, these figures may not truly reflect the scale of the problem. Underreporting is a major concern in the field of sexual health. Many women, due to embarrassment, lack of knowledge, or fear of judgment, do not report their sexual health concerns. Some studies suggest that the actual prevalence of sexual dysfunction in women could be as high as 60%. The underreported numbers reflect a society where women's sexual health is often overlooked or dismissed. This silence around women's sexual health not only contributes to the stigma, but also hinders our understanding and treatment of these conditions. These figures are not just numbers. They represent real women facing real issues, and it's high time we pay attention. The unspoken epidemic of women's sexual dysfunction needs to be addressed, and the first step towards that is breaking the silence and acknowledging the scale of the problem. It's time to put women's sexual health at the forefront of our healthcare discussions. Sexual dysfunction in women is a complex issue with a myriad of contributing factors. Let's take a moment to delve into these complexities, to better understand the challenges women face. At the forefront, we have physical health. This can include chronic illnesses, hormonal imbalances, and medication side effects, to name a few. For instance, conditions like diabetes or cardiovascular disease can affect blood flow and nerve function, leading to issues with sexual response. Hormonal changes, particularly during menopause, can also contribute to sexual dysfunction. Then we have mental health. Depression, anxiety, stress. These are just some of the psychological factors that can impact sexual desire and satisfaction. It's a two-way street. Mental health issues can lead to sexual dysfunction, and vice versa, creating a vicious cycle that can be difficult to break. Relationship issues also play a significant role. Lack of communication, unresolved conflicts, or feelings of disconnect can all contribute to sexual dissatisfaction. This is why it's so crucial to foster open and honest dialogue about sexual health within relationships. Next, we've got societal pressures. We live in a world that often imposes unrealistic expectations on women's sexuality. This can lead to feelings of inadequacy, performance anxiety, and other issues that can hamper sexual function. Lastly, we have other factors like past trauma, body image issues, and aging. Each of these can contribute to sexual dysfunction in their own unique ways. Now, imagine these factors interacting and exacerbating each other. Physical health issues leading to stress, which in turn strains relationships. Societal pressures compounding feelings of inadequacy from body image issues. It's a tangled web of complexities that can make sexual dysfunction in women a challenging issue to address. But here's the silver lining. By acknowledging and understanding these complexities, we're taking the first step towards better treatment. We're paving the way towards more comprehensive, more effective care that considers the whole person, not just individual symptoms. Understanding these complexities is the first step towards improving treatment and care for women experiencing sexual dysfunction. So, how can we improve the treatment of sexual dysfunction in women? At present, there are a few treatment options available for women experiencing sexual dysfunction. These range from hormone therapy to psychological counseling, from physical therapies to medications. Each of these has their own merits, but they also have limitations. Hormone therapy, for example, can have side effects and may not be suitable for all women. Psychological counseling can be effective, but access to qualified therapists can be a barrier. Moreover, the medical profession's understanding of female sexual dysfunction is still developing. This is partly because it's a complex issue with many potential causes, including physiological, psychological, and social factors. There is a pressing need for more research to fully understand these complexities and develop more effective treatments. In parallel, there's a need to enhance the training of healthcare professionals. It's crucial that doctors, nurses, and therapists are equipped with the knowledge and skills to diagnose and treat sexual dysfunction in women. This includes being able to discuss the issue openly and sensitively with their patients and being aware of the latest research and treatment options. Patient education is another key part of the equation. Women need to be empowered with knowledge about sexual health and dysfunction. They need to understand that it's a common issue, that it's okay to seek help, and that treatments are available. There are also some promising developments in the field. New drugs are being tested, and innovative therapies are being explored. For instance, there's growing interest in the potential of mindfulness-based therapies to help women manage stress and anxiety, which can often be factors in sexual dysfunction. However, it's important to remember that improving treatment is not just about developing new drugs or therapies. It also involves changing societal attitudes towards female sexual health and breaking down barriers to care. The stigma around sexual dysfunction can prevent women from seeking help, and this needs to change. Improving treatment is not just about developing new drugs or therapies, it also involves changing societal attitudes and breaking down barriers to care. Now that we have a better understanding of sexual dysfunction in women, what can we do? Just as we've unraveled the complexities of the issue, let's also unravel the threads of potential solutions. It's a tri-fold path where individuals, healthcare professionals, and society at large each have a role to play. As individuals, we can start by educating ourselves, breaking the silence, and fostering an environment of open conversation. It's about acknowledging that sexual health is a fundamental part of overall well-being and allowing ourselves and others the grace to seek help when needed. Let's make it a point to prioritize our sexual health just as we do our physical and mental health. For healthcare professionals, it's about going beyond the traditional approach, delving into the heart of the matter and understanding the unique experiences of each patient. It's about creating a safe space where women feel heard, validated, and supported. The importance of continuous education cannot be overstated. Staying abreast of the latest research, understanding the nuances of female sexuality, and integrating this knowledge into patient care. And then there's the role of society. We need to reshape societal perceptions and eliminate the stigma associated with sexual dysfunction. It's about promoting sexual health education, advocating for policies that support women's sexual health, and fostering a culture that respects and values women's experiences. But how can we make these changes happen? It starts with awareness. Share this video with your friends, family, colleagues. Let's amplify the conversation, spark a dialogue, and make a difference. For those seeking further understanding and resources, there are numerous platforms available. Websites, online forums, support groups, and educational platforms are just a click away. Knowledge is power, and in this case, it's the power to improve lives and transform healthcare. This isn't just about improving the treatment of sexual dysfunction in women. It's about empowering women, fostering empathy, and creating a more inclusive and understanding society. Remember, change starts with a conversation. So, let's keep the conversation going.